I'd like to speak for a moment about the particularly important topic of schools. The Minnesota recommendations include school-specific guidance for limiting close contact interactions. However, consistent with guidance from the Centers for Disease Control and Prevention, the State Health Department has not recommended that K-12 schools should close unless specific conditions exist and they are advised to do so by health officials. However, as the situation evolves, there may be points in the future where specific or broader closures would be ordered. Parents of children and teens with underlying health conditions should now consider distance learning as a precaution. I know that this runs counter to the instinct that many of us have to protect our children and to see closing schools as a precaution. And given the concern that we all have about a new virus, I don't blame anyone for asking these tough questions. But it's important for school officials and parents and all of us to understand a few things. First, evidence shows that children and teens are at the lowest risk from COVID-19. Second, community mitigation measures of the kind announced today are designed to slow the spread of a disease in a community. Third, evidence from other areas of our country hit by COVID-19 shows that early, short to medium closures of schools just don't have much impact on the rate of spread of COVID-19. According to the CDC, there might be some impact of much longer closures later in the course of an outbreak, but that modeling also shows that other mitigation efforts, such as we've been talking about today, actually have greater impact on the spread of a disease. In other countries, communities that have closed schools, for example in Hong Kong, have not had more success in reducing spread than those that did not close schools, such as in Singapore. So the reasons that we have not recommended closing schools at this time are based on what we know so far, based on evidence of where the risk is and what strategies are successful and not. And that's why we've been continuing to say we are not making broad recommendations for closure of schools. However, we know that epidemiology is just one consideration in these tough decisions. So we'll be working carefully with the governor and with the Department of Education to continue to keep eyes on this question, and we'll be just more and more trying to understand the circumstances under which closures might be considered.